Health benefits of the keto diet. This type of diet was first adopted in 1970, but its history dates back to the early 1900s. A ketogenic diet plan is formed from 80% fat, 15% protein, and 5% carbohydrates. The keto diet is characterized by the reduction of carbohydrate intake to less than 50 grams per day. We must, however, take care while on this diet, as it may lead to the development of ketosis, which is characterized by the formation of excess ketone bodies which may be harmful to one's health. What is ketosis? It is characterized by high levels of ketone bodies in the urine or blood. Following a low carbohydrate diet, the brain may be on a low supply of glucose. Oxaloacetate then helps to eliminate fat from the body due to its excess consumption through the breakdown of large fat molecules into their smaller parts. This could lead to the production of ketones in the liver, as a result of incomplete fat oxidation. The human brain primarily depends on glucose, but not on fat. Fatty acids would have to be broken down to form ketones, which are the primary source of brain, muscle, and tissue energy. A ketogenic diet should be customized to each individual's special requirements. In addition to the diet, enforcement is necessary when changing one's eating habits. Here is a description of the ketogenic diet for medical patients. The patient's weight, height, and gender should be used in customizing their keto diet to maintain well-being. Children above 3 years of age require at least 1 gram of protein per kilogram of body weight. Before starting the ketogenic diet, some people may need to undergo a period of fasting for 2 to 3 days. During this period, they can eat unsweetened gelatin and drink water. Blood glucose and ketone levels should be regulated while fasting. Electrolyte levels and other critical parameters must also be tracked for the patient's well-being. The patient is usually started on 1/3 of the allocated calorie intake in the first 24 hours. This is then doubled the next day. The patient can then eat the allocated amount of calories from the 3rd day onwards. After patients are discharged from the hospital, they will be maintained on the regimen for 2 to 3 days. Low-carbohydrate diets include eggs, heavy cream, sausages, mayonnaise, seafood, tuna, and poultry. It is wrong to overeat starchy foods such as rice, pasta, pizza, potato, fruits, starchy vegetables, and sources of basic sugars. Ingestion of enriched vitamins and minerals would be beneficial to those on the keto diet. Who benefits from the keto diet? People often opt for the ketogenic diet for weight loss, but it can also be used for many other medical conditions. In addition, this could benefit people with heart diseases, certain brain disorders, and pimples. You may want to talk with your physician before attempting a ketogenic diet, particularly if you have type 1 diabetes. These are the health benefits of the keto diet. 1. Epilepsy management. Ketogenic diet has proved successful for both children and adults whose seizures are difficult to manage. This diet is for those children whose seizures cannot be overcome with the current anti-epileptic medications. GLUT1 is a glucose transporter that transports glucose from the blood vessels to the brain. Lack of GLUT1 causes convulsions in infants. During starvation, ketone bodies are the body's key energy source. Ketogenic diet programs emulate the physiological and biochemical response to fasting. This diet is useful for these children because ketones are one of the best sources of energy for the nervous system. 2. Improves mental health. Patients using ketogenic diet report changes in motor and behavioral control, alertness, and cognition. This diet is suitable for people with depression and bipolar disorder. 3. Weight loss. This diet is ideal for individuals who plan to slim down over many months. This is presumably because it takes more energy to turn fat into energy than it does to change carbohydrates into energy. Consuming high protein and high fat foods would help us feel satisfied faster. Ketone bodies can help control appetite and thus minimize energy consumption. This low carbohydrate or low sugar diet will help you shed weight and belly fat. 4. Prevention of heart diseases. It helps to minimize the risk of acquiring heart diseases by regulating our cholesterol levels. When cholesterol is present in high amounts in the body, it increases the risk of atherosclerosis, which can make an individual prone to developing a heart attack. Ketogenic diet would help in balancing the levels of both good and bad cholesterols in the body. 5. Managing diabetes. It is important to consume fewer carbohydrates in order to control type 2 diabetes. Studies have shown that low carbohydrate consumption can decrease the need for medications and help regulate the blood glucose in those suffering from diabetes. 6. Improvement of neurologic disorders. Keto diet is an effective choice for illnesses such as Alzheimer's and Parkinson's disease. Medium-chain triglycerides like coconut oil increase the number of ketone bodies in the blood. An increased level of ketone in the blood has also been linked to enhanced memory. 7. Cancer treatment. Ketogenic diets can be very helpful in cancer therapies. It will significantly reduce the tumor growth rate and increase the patient's survival rate. The keto diet also improves the possible gains from chemotherapy and radiation treatment. 8. Treatment of autism. Some medical facilities have been known to use the keto diet to treat autism. According to some studies, children with autism who were treated with a ketogenic diet demonstrated improvement in cognitive capacity, verbal abilities, and reduced seizure frequency. 9. Treatment of acne. Cutting down on carbohydrates and fructose has also been said to be helpful in the treatment of acne. The component of a ketogenic diet that reduces insulin levels can also improve your skin's well-being. Insulin use can generate hormones that contribute to acne outbreaks. However, more research is needed on this. 10. Treatment of polycystic ovary syndrome, PCOS. This is characterized by an increase in the size of the ovaries with small cysts around the eggs. It is a common cause of female infertility and can be caused by high amounts of insulin. Adopting a ketogenic diet with regular exercise can help to lower the levels of insulin in the body and help in the treatment of this condition. 11. Endurance. The keto diet may help to increase the endurance of athletes such as marathon runners and cyclists. It helps to increase the muscle-fat ratio, thus increasing the amount of oxygen available to the body during these activities. We should, however, note that it may not work as well as other diets in achieving this. Drawbacks of the keto diet. 1. It may lead to the development of acidosis. 2. Impaired immunity and low platelet count. 3. It may pose an increased risk to the development of kidney disease. 4. It may impair bone mineralization. 5. Dietary fibers play an important role in a nutritious diet. Lack of high-quality dietary fiber may cause constipation. 6. Carbohydrate consumption can improve your brain chemistry and help with sleep. You may find it difficult to fall asleep easily while on a ketogenic diet. 7. The most important dietary sources of vitamins and minerals include fruits and vegetables. This is not present in a ketogenic diet, which may lead to nutritional deficiencies. 8. Rare side effects include pancreatitis, cardiomyopathy, QT syndrome. Who should not follow the keto diet? Knowledge about the ketogenic diet is important, as there are conditions in which the ketogenic diet must not be practiced. People with the following ailments should not adopt the keto diet: individuals who have pancreatitis, those with poor nutritional status, persons with impaired liver function, individuals with any form of kidney damage, those with gallbladder disease, individuals suffering from indigestion, pregnant women and lactating mothers, those with gastrointestinal motility disorders, persons with gastrointestinal cancer. If you like this video, share it with your friends and consider subscribing to our channel for more future videos. Please see the links in the description below for more help and support. Until next time, thank you.